Bismillahirrahmanirrahim. Today, inshallah, I shall continue our discussion of the skeletal system. Previously, I had described to you that at least conceptually we can divide the skeletal system into two: the axial skeleton, the skull, along with the vertebral column over here, and the rib cage constitutes the axial skeleton. Now, I just wanted to bring to your attention, this is the vertebral column, which protects the spinal cord. So it's the vertebral column, the bony structures that protect the neurological tissue that is the spinal cord. So what constitutes the axial skeleton is the skull with the mandible and the vertebral column and the rib cage. The appendicular skeleton, if you recall, includes the upper and lower extremities. The term appendix, as I said before, implies something that is added to something, such as the appendix of a book, which is added to the end of the book usually. So appendicular skeleton is something that's attached to the axial skeleton. In the case of the upper extremities, it is the clavicle over here and this triangular shaped bone over here. In case of the lower extremities, it is the pelvic bones over here. Today we shall focus on the appendicular skeleton. If you recall, in the upper extremity, this is the arm, this is the forearm, that's the wrist, and that's the hand. The entire upper extremity is attached to the axial skeleton by the use of these two bones. This is the clavicle, and this triangular shaped bone is called the scapula. In fact, the entire upper extremity is attached to the axial skeleton at only one joint right here, between the clavicle and the sternum. This part of the sternum, if you recall, is the manubrium. So there's only one joint between the upper extremity and the axial skeleton, between the clavicle and the sternum right here. This triangular shaped bone, the scapula, is not attached to the axial skeleton by any joints. Rather, it's kind of like taped to the rib cage with the use of many muscles. So it's kind of like duct taped to the rib cage with all kinds of muscles. That is good in one sense because it allows great mobility in different directions and allows us to lift our hands in different ways. Now here's another representation of the upper extremity. So here's the scapula, here's the clavicle. This is our shoulder joint, it's a ball and socket joint. In our arm there's only one bone, in our forearm there are two bones. Our wrist has 9 bones, and these are called carpal bones. The bones in the hand, these bones over here, they're called metacarpal bones. Meta means beyond. So these are carpal bones, and beyond the carpal bones you find the metacarpal bones. The term meta meaning beyond. And these are phalanges or fingers. Each of our fingers, of course, has 3 bones except for the thumb, which has 2. Now our forearm is interesting because of course it has 2 bones, but this joint is very interesting because it allows this bone to kind of go over that bone, which is great because then we can use screwdrivers to turn things around. And that allows the rotation of the forearm. So this bone is called the radius, allowing radial rotation, and this bone is the ulna. So it's the relationship of radius and the ulna which allows us to rotate our forearm. Again, here's the clavicle, scapula, humerus, the bone in the arm, ulna and radius, the carpal bones, the metacarpal bones of the hand, and the phalanges are the fingers. Here's a cross-section or representation of a generic joint. The 2 ends of the bones both have cartilage. This allows, of course, for smooth gliding across the joint. And the joint space itself has a little bit of fluid to facilitate that. Now, surrounding, protecting the joint are ligaments. So ligaments are kind of like duct tape that protect the joint and keep it secure. Now a survey of the lower extremity. This is the pelvis. Over here we have the sacrum, and this is coccyx or tailbone. Now these are called the pelvic bones, and they're joined over here in the middle. So our pelvis is kind of like equivalent to the scapula and the clavicle in the upper extremity. It is the transition from the axial skeleton to the lower extremity over here. A cartoon representation of the lower extremity here is the pelvis. This is the femur. This is the tibia and the fibula. And these are tarsal bones. Now these are kind of analogous to the wrist bones. In the wrist we have carpal bones. In the feet we have tarsal bones closer to the toes. So these are tarsal bones, and beyond the tarsal bones are metatarsal, meta meaning again beyond the tarsal bones. So tarsal bones and metatarsal bones and phalanges or toes. Again, the pelvic bone, femur, which is the bone in the thigh, the tibia and the fibula, tarsal bones, metatarsal bones, and the phalanges. The patella is the kneecap. Now, just like there are different types of bones, there are different types of joints. Some joints, like those in the skull, have fused over time like this, and they cannot move, and they're called immovable joints. As the baby is born to facilitate the process of birth, these joints are not fused. They fuse after birth. This is a hinge joint, like the one you find in the knee. It's kind of like a door, opens and closes type of thing. Compare that to the ball and socket joint that we find in the shoulder. Clearly, the shoulder joint is much more movable in different directions than is the knee. There's a lot more you can do with the ball and socket type of joint that you can do with the hinge joint. We already talked about the pivot joint between the first two vertebrae. The wrist is quite a remarkable thing. We don't give enough attention, actually. It has 9 bones, and some of them glide over each other, facilitating different various movements of the wrist. If you pay attention when you're writing, you're using very fine motor movements of your wrist. So these are just some examples of different types of joints that exist. As I've suggested before, there's a lot of life inside the bones. In fact, bone marrow is where blood cells are made. So all the component cells of the blood, such as white cells, red cells, and platelets, and etc., they're made in the bone marrow. There are blood vessels that pierce through the outer part of the bone and enter the marrow, feeding the marrow, so to speak. The very hard outside part of the bone is called compact bone. The more softy, spongy type of bone inside is called the spongy bone. Now this picture illustrates a very important concept, and that is the difference between tendons and ligaments. Now tendons and ligaments are made of the same thing. That is, if you were to look at them under the microscope, they would look the same. But they're given different names based on their function. Ligaments are kind of like duct tape to secure a joint. So ligaments bind bone to bone to secure a joint. They form, for example, like the joint capsule around here, protecting, securing that joint. Tendons, on the other hand, bind muscle over here to bone. So tendons bind muscle to bone, whereas ligaments bind bone to bone. They're made of the same material, but they're given different names based on their function. Ligaments bind bone to bone, and tendons bind muscle to bone. And if you recall, I suggested muscles work by contracting, and muscles work on joint that they cross across. And muscles function across a joint. That is, they pull this bone closer to that bone by contracting. So muscles always work across joints, almost always. Now this picture also illustrates the difference between tendons and ligaments. So this is the Achilles tendon, and these are all ligaments of the ankle. So people can have ankle injury, unfortunately, that is a ligamental injury or it's a tendon injury. The knee joint has a whole lot of ligaments, and these are frequent victims of sports injuries. For example, people can have like ACL tear, the anterior cruciate ligament tear of the knee, or they can have a medial collateral ligament or MCL tear. This can be very difficult in athletes. But ligaments, if you recall, secure a joint, and they connect bone to bone. Now here's the scapula attached to the back of the rib cage. As I suggested, there are lots of muscles that are attached to the scapula, holding it together like this. This picture also shows the vertebral column over here. Now the spines of the vertebral column, as suggested before, act as attachment points for muscles that help us bend and lift up, etc. The vertebral column itself is divided into different parts. We have 7 vertebrae in the neck. These are called 7 cervical vertebrae. We have 12 vertebrae in the chest. These are called 12 thoracic vertebrae. We have 5 vertebrae in the lower back. These are the 5 lumbar vertebrae. And we have sacrum. This is actually a fused vertebrae. And finally, the coccyx, which is a tailbone. So we have 7 cervical or neck vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, the sacrum, and the coccyx. Each of these thoracic vertebrae has a rib attached to them like this. So we have 12 thoracic vertebrae, each of them has a pair of ribs attached. We'll talk briefly about disorders of the bone or injuries of the bone. This picture shows different types of fractures that can occur. A fracture that is not through and through like this, that's called a green stick fracture. This is a spiral fracture, which is kind of like a longitudinal fracture. Instead of going like this, is more like this. A comminuted fracture is kind of bone smashed into small pieces like this. A transverse fracture is through and through bone like this. A compound fracture is when multiple bones are involved. An open fracture is when it comes out like this. So fractures are classified like this, and classification is important because the treatment depends on the type of fracture. Now, the vertebral column, the vertebrae can collapse in themselves. This is called a vertebral compression fracture. This is an example of a small, tiny hairline fracture like this. It still hurts. Now, this is a very important picture. Now, this picture demonstrates a pathological phenomenon, a disease phenomenon called osteoporosis, or thinning of the bone. See, normal bone has a certain density. So this is an example of a normal, healthy-looking bone. Sometimes people lose bone, and that can be dangerous because then the bones can break. So the most common reason why the elderly get admitted into nursing homes is a fracture after a fall. Because fractures of pelvic bones or the thigh bone, for example, causes immobility, and that can be very dangerous for the elderly. And osteoporosis, or the thinning of the bone, is one very important risk factor for this. This is important to understand and appreciate because it's actually treatable and reversible. So a normal bone has a certain density, and if it gets porous, that's called osteoporosis. When people have a curvature in the spine like this, that's called scoliosis. I'm sure you've heard people have had shoulder dislocations. In this case, there's no breaking of bone. It's just the humerus gets dislocated and pulled out of the ball and socket joint. There's the anterior or front dislocation and the posterior or back dislocation. And it needs to be put in place by a professional, of course. This is the knee joint again. These are the ligaments. And this is a meniscus. This is a cartilage disc that kind of like is a shock absorber for the knee joint. Unfortunately, people can get also tears in their meniscus. It's called a torn meniscus or meniscal tear. And that can be very painful. Sometimes you just remove that part and smoothen the edges out so it's not as painful. I also wanted to highlight two other conditions of the joints. One is osteoarthritis, and the other one is rheumatoid arthritis. Over here you see a normal joint. Osteoarthritis is kind of like wear and tear injury to the joint. For example, runners might get this in their hips or their knees. Baseball pitchers might get this in their shoulders. Repetitive trauma to the joint causes wear and tear of the cartilage. And over time, this can basically destroy this joint, and you can have bone and bone, and it's very, very painful. That's osteoarthritis. It's kind of like a wear and tear injury to the joint. Rheumatoid arthritis, on the other hand, is a very different condition. It is autoimmune disease. An autoimmune condition is where an individual's immune system attacks their own body. If the immune system, for example, attacks the insulin-producing cells in the pancreas, that results in type 1 diabetes. If the immune system attacks the membrane here in the joint, that results in rheumatoid arthritis. And over time, this attack on the joint membrane can destroy the joint. Now, as you can imagine, this is not related to any joint. And in fact, any joint can be involved and frequently involves the joints of the hand. So here again is osteoarthritis, or injury-related repetitive trauma. As you can see, over time, the joint is nearly destroyed over here, and people can even have tiny bone spurs that can cause a lot of pain. As I suggested, this is rheumatoid arthritis. It can affect any joints and frequently affects the joints of the hand. This is an autoimmune condition. People can also get repetitive motion injury. People who type a lot, for example, their wrist can hurt after a while. Nowadays, people can have injuries also related to playing too much video games for serious, PlayStation, Xbox, etc., or using their thumbs too much on their phones. This, in fact, can actually cause trouble in the joints of the hand. finally, I wanted to finish by talking about the bone marrow. As I suggested, the cells of the blood are made in bone marrow. So here's a blood vessel that's feeding into the bone, and here's a blue thing. Here's a vein that takes all the blood from out of the bone. And inside the marrow over here is where all the red cells, white cells, and other components of the blood are made. So there are stem cells, or basic cells, that give rise to all the different types of cells in the blood. This is a red blood cells, and these are white blood cells, different types of cells that help us fight infections. And these tiny things here are platelets that help us heal wounds. So again, bone marrow is where red cells, white cells, and platelets are made. And indeed, the marrow is anything but inactive. Until next time, as-salatu was-salamu ala rasulillah walhamdulillahi rabbil alameen. Assalamu alaikum.